My dear friends, I'm making this video because I've noticed a lot of my patients, either virtually or the ones that come to the office, have a pervasive feeling of sadness, depression, as if loss of control. And I want to tell you that you shouldn't have to feel that way. There is no reason to feel that way. You shouldn't fear this. I'm saying don't be cavalier. You have to follow all the rules of infection control, which you have followed anyway before. You should not cough on someone's face. Make sure that you wash your hands after you go to the bathroom and after you touch any surfaces. Make sure that you moisturize your nose and mouth. That will reduce the likelihood of having any cracks in your skin's defense system, allowing other pathogens like the COVID-19 to penetrate. But there are other options of treatment that I want to discuss with you right now. About a month ago, I had the idea of talking about the immunoglobulins, using them as the defense that we all contain and sharing our immune system with the immune system of those whose immunity perhaps is a little weaker. I was fearful of saying it in public because I thought, just like everything else, it will be sold out, it will be unavailable. But when I found out that the antimalarials have not been as effective as initially promised, I went on a campaign to try and get the idea out, and I've contacted my colleagues in Israel, in Italy, and here in the emergency room. But I think bureaucracy and the fear of this not being used before for this problem has put a stalemate on its use. I've been told by a patient of mine that at Mount Sinai lately they've tried to do something similar to what I'm suggesting. They're asking people to donate their blood if they had the COVID-19. That's using this idea that I was talking about, and also posted it on the Facebook. You can see it at Dr.Levit. I remember in 1994 I was in med school. There was a pediatric patient in Albert Einstein Medical School in the hospital who had a very dangerous, life-threatening condition called Kawasaki syndrome. Nobody knows exactly what's caused it. Most likely it's also a viral stimulated condition. And what they did is they gave him IV immunoglobulin, and that saved his life and prevented severe consequences as aortic aneurysms. Now that's stuck in my brain forever. Since then I've used it in other conditions. Not only me, it's been used to treat viral infections, bacterial infections, things as Guillain-Barré, and even been used to treat autoimmune disorders, some of them getting cured with the use of IV immunoglobulins. How does this work? When our body is exposed to a foreign bacteria or virus, it breaks it into little pieces and presents it to the immune system, to the police force, telling them, recognize this as being foreign. We're going to help you. How are we going to help you? We're going to give you little pieces of that, because it tries to cloak itself just as this COVID-19 is trying to cloak itself with similar things to our human body. In this case, it tries to join through the angiotensin converting enzyme number 2, making it mimic our own cells. What it then does is, after it breaks apart and shows what separates it from our own human cells, it tags it. So it put little stickers and saying, you see, whenever you see that kind of sticker, that means this is an imposter. And our body goes ahead after that imposters and destroys it, cleaning it out of the system, not allowing it to wreak havoc on our cells, causing this huge exuberant inflammatory reaction that later on results in our inability to breathe or our cardiovascular function stopping from being effective and basically succumbing to drowning in our own fluids of inflammation. So the question is how to make it work best. In China, I was just told by my friend who I've prescribed this treatment for, who's suffering from COVID-19, a physician who got exposed to someone with this condition, that there were 3 cases that it was successful on. They did not use the dose that I recommend. I recommend using IV immunoglobulin or sub-Q immunoglobulin, which has been used in Scandinavia for a while, been approved only in 2006 here in the United States, and they used it on 3 patients with good results. but they used 0.5 milligram per kilogram. The dose I'm recommending is 1 milligram per kilogram for 3 consecutive days. Perhaps it will be even more effective if we're at high risk to give at the first day 2 grams per kilogram loading dose and then 1 gram per kilogram. Now, there's nothing really novel in what I'm suggesting. If we're looking at the most innovative treatments for psoriasis, they are specifically going to target the immunoglobulin system. And the way they work it is they attack the specific factors that are the interleukins or the inflammatory mediators that cause the psoriasis to get the way it looks, out of control, and calming it down. The same thing goes with this method. Now, one of the issues is if we were not really exposed to this COVID-19 before, will our body have the necessary tags to recognize what's foreign? Well, remember, even though this COVID-19 is not exactly like the previous COVID that we had and the MARS, the Mediterranean acute respiratory syndrome that we got from camels and causes much more severe death, about 34%, as opposed to the SARS-1 that was discovered in 2002 that has about 10% death. And this COVID-19, to bring it into perspective, about 4.45%, looking at the numbers from yesterday, today again is March 26th, so as of March 25th, these were the numbers. And in my opinion, it's even lower because there are a lot of patients who are positive but don't get tested or not put into that equation, that are simply not making it into the hospital and therefore are not put into that statistics. It will still be likely that there are other people who've been exposed to this virus. Maybe they didn't even know that. They thought it was a regular flu. Parts of it, because this virus is about 50 to 76% different than the virus that was there before. So assuming we've been exposed to it, taking these immunoglobulins and giving it to other people who either as an immune preventative you can do, it will give us immunity for 3 to 4 weeks, especially if you're at high risk. And high-risk people are people over 80. And I don't believe really it goes by age, it goes by the age of our body, our organs. So if you have cardiovascular disease, if you have lung disease, if you have diabetes, if you have cancer, those are the groups of people that are more susceptible to succumb very rapidly to this disease. Those people, I think, are the ones that we should offer this immunoprotective therapy. If they're already coming into the hospital and you see that they're in a critical situation, again, yes, give them the Plaquenil, give them the Zithromax. You want to add a little bit of the zinc. Obviously, you have to make sure you don't give too much zinc, and those who read about the zinc and try to supplement realize you may get some anemia from it. So be careful. Everything is good in the right amount, and best to advise with a physician and not to try it on your own. So to summarize, using the IV or subcutaneous immunoglobulins helps provide immunity for 3 to 4 weeks. We should use it to people who are susceptible or who are exposed at high rates to the patients with the COVID-19. If you're sick and you're brought to the hospital and you fit the criteria of high risk, again, right away it should be administered. This medication is given IV, given slowly. The reason I am making this video is because this medication is actually very expensive. Few people will be able to afford it. And why is it expensive? I've checked the prices about a month ago when I was looking into it to inject myself. I like to experiment everything on my own, on myself. The prices are 1,000 times more here in the US than they are in Europe. Why? If we are supplying 50% of the immunoglobulins to the rest of the world, how come it's costing much cheaper, much less in Russia, for example? So in Russia, the same IV immunoglobulin, 700 milligrams for my weight would cost $700. For the same in the US, that's the pharmacist cost would be 7,000, and others would be, depending on the brand name, would be 10,000 plus for one session. Why is that? According to the WHO, IVIG is one of the safest essential medications that are available. So If you're comparing it to anything else, Plaquenil, whatever else that you worry about, the QT intervals, the increased risk for having heart problems, this does not have it. You just need to infuse it very slowly, or you can do it subcutaneously, and we can look into that, how it's done. You just need to obviously have it injected by a physician. So again, you can use it either as a protective way to reduce the likelihood of you getting infected, or if you get infected, it won't be as severe, or you can use it as a treatment. The moment you find a patient at risk who is with COVID-19, we should try and make that available. We should try and make it at a cheaper rate. Now, the only caveat is that using this method, you wonder, are you shooting blindly in a dark room? Basically, you're not laser pointing. It's not a laser shot that you're aiming as a sniper. The reason is you're taking blood, plasma. We've used plasma for PRP, for hair regrowth, for joint recovery. This is the same idea. The plasma, instead of platelet-rich plasma, we're using the immunoglobulin. So you take the blood, you donate the blood, and then they take the plasma out of it and they concentrate the immunoglobulins, the IgG and IgA. IgA is found in the mucosal surfaces, IgG is found in the blood. IgG would be just enough as well. And then you inject that either into the skin or into the blood. But if you just take it randomly, you are practically, as I explained before, imagine you're hearing someone shooting and you're shooting around, but you're not sure, are you going to hit the person or you're not going to hit the person? That's that, and that's why you want to flood it. You want to give a higher concentration of these immunoglobulins. On the other hand, if those who have had the disease will donate their blood and will, obviously, if they recover, they have to have the antibodies. Once the blood is checked that they don't have any other diseases and it is safe to inject into others, meaning they don't have HIV, they don't have hepatitis or anything else that we don't want to transmit any virus with this IVIG that we may not be aware of, then we're able to take that specific IVIG, specific immunoglobulins, and inject it into the patients who are at high risk. And then it's like a sniper, aiming and hitting a target perfectly well. And then you don't have to have such high doses. Now, it is almost as if we are being brought to this moment to realize that we should not look far for the answer, because the answer to our problems is found within us. If you look at the idea of Jesus Christ, Sacri Sancti, His flesh and blood, this is exactly the opportunity where we, with our own blood, are able to save the world. Those who are the victims of the COVID-19, you guys can be the heroes, saving the world. And it is very easy. And we can take the big companies, pharmaceuticals, out of the equation. We're donating the blood for free, and the cost of processing it can be really lowered down. Because if it is 50% of it being transported from here, and yet in Europe it's costing 1,000 times less than it's costing here, then think about how it is playing out. I'm sure the cost would be much less for us if we all come together to save our race, to help our economy, to improve our morale, and we will become stronger and better, not only as humans, but as humanity. Thank you very much, and please share it, because it's important that our government will get that message and that no bureaucracy will stand in the way of progress in our economy. Thank you very much.